We are back with Dr. Christy Leith-Warren of Cone Health Urgent Care at Reedsville. All right, so COVID-19, it's going to be around this fall as well, just like flu. What steps do we need to protect ourselves from COVID?
So, unfortunately, a lot of people are not going to want to hear this, but masking again is probably going to be one of the best things that you can do. Getting vaccinated, there's a new vaccine coming out. So, there are many strains of COVID that are out here. So, getting vaccinated is key.
All right, so if you've been exposed to someone who has COVID, what should you do? Do you take a test? Do you mask up? What do you do? For how long? All that kind of jazz.
So, CDC guidelines recommend that if you've been exposed, you should wait at least 5 days to test. If you have active symptoms, then you should go ahead and test immediately. So, you can test a little too soon and show a negative result, but giving that full 5 days will ensure that you're getting the most accurate result.
And in that 5 days, I mean, you don't know if you have it or if you don't have it. You've been exposed. I'm guessing you want us to wear a mask during those 5 days, but we can still kind of go about our business.
Yeah, COVID guidelines, they're not as strict as they were, but masking is going to be the first way of prevention, especially if you're around people who are high risk and you don't know what you have. CDC is ramping up the program where they're sending out the home tests as well. So utilizing that is very important as well.
Yeah, home testing. All right. So is there anything that can help the symptoms of COVID?
So, COVID is a virus. So there are antivirals, is what they're called, to kind of help lessen the severity of the symptoms, if you want to put it that way. The COVID vaccine, people think they're not going to get COVID because of the vaccine. That's not the case. If you do get COVID and you've been vaccinated, like I said, and you're able to, I would recommend doing an antiviral, kind of like we do for the flu. So there are two that we use, kind of based on your health history and lab work. Some doctors may choose one over the other, but one that's very popular is Paxlovid. That's the one that has the commercials on TV that you're hearing the most about.
All right, and if you've been exposed or something of that nature and you're not sure what to do, who do you contact?
You can call your doctor. Also, Cone Health has several ways that you can get in touch with a provider. We have the virtual option through getting a virtual urgent care visit where you're in the comfort of your own home. You can do an e-visit, which is you fill out a questionnaire online and a provider will respond and send necessary prescriptions if you need to. If you have more severe symptoms, of course, go to the ER, especially emergency department, excuse me. If you have shortness of breath, difficulty breathing, those things you do not need to wait for.
Okay, that you go straight to the ER for that one. All right, what are some other maybe common fall illnesses or injuries that maybe people don't think about as often that we need to be aware of?
So, in urgent care, sports is back on the scene for high school and, middle school, all ages rather. So seeing a lot of sports injuries, still seeing the typical, schools back in session, pink eye or conjunctivitis, bronchitis, those kinds of things. And those, like I said, those are more in our younger population, but allergies, like I said, is the main thing that we're seeing, and the common cold even still. So those are things to think about, when you're having symptoms. You got a couple of things that could be and it could not be.
All right, let's go back to the allergies since you mentioned it again. Are there things that we should be doing on a regular basis to make our allergies better? For instance, if I start feeling like wheezy and sneezy, do I just take my allergy pill and expect it to just like work?
It may take a few days. It's not an instant relief. I tell patients in urgent care that know they have allergies, you have to take the medicine daily for it to work and to be effective. And if you take it, like I said, prevention, it's going to keep you from developing those things that build up inside of your body that trigger the symptoms that you have.
Okay, so before the fall allergies start, or if you haven't started your, whatever your allergy med is, you probably should start taking it so that as we get into the middle of fall, that we're going to be covered a little bit.
I agree, and definitely that's the truth. And another thing, a lot of rain. We've been getting a lot of rain this year. So rain is one thing that can trigger environmental allergies for us. So most people think, oh, it's rained, it's going to wash the pollen away. That's not the case. So, just because it's raining, like I said, allergens are still out there. And change in the weather can also be, one thing that can trigger a lot of allergies for people too.
Interesting. I did think it washed it all away. Okay. All right. If we hurt ourselves as we're doing work around the house or the kids, on the soccer field or something like that, when do we go to the ER versus just going to an urgent care?
So ER, is more, like I said, for the severe injuries. So if you have a break and and this sounds terrible, you can actually see it through the skin or you can't walk on it, that's an ER visit. If you're able to walk on it, but it's still hurting and you don't know, it's been a few days, urgent care. I will reassure you though, if you do come to an urgent care and there's something, that's high priority, that's, urgent, we will get you sent over to the local ERs as well.
But anything where there's shortness of breath or anything like that, right to the ER.
Yes, especially if you can't talk in a complete sentence, if you have to lean forward to catch your breath or breathe well, or if you walk a short distance and you get really short of breath, those are key things that you can look for to go to the emergency department. And that's because they have the necessary resources to treat you immediately.
Gotcha. Okay. Thank you so much for your time and expertise. If you at home missed any of this, you're going to be able to find it on our website, WFMYnews2.com, in the 2 Wants to Know section.